Hello friends, and today I will be telling you about the most important, most commons in general surgery, and I will be starting off with this. The most common cause of thoracic outlet syndrome is scalene anticus. Scalene anticus. Now the most common abdominal emergency of early childhood. See, early childhood is intussusception. Alright, so most common cause of toxic megacolon is pseudomembranous colitis. It is pseudomembranous colitis. Now, the most common osseous lymphoma, primary and secondary, it is diffuse large B cell lymphoma. So, diffuse large B cell lymphoma. Now, the most common component of the mixed germ cell tumor is embryonal cell carcinoma. The most common component of mixed germ cell tumor is embryonal cell carcinoma. Now, the most common cause of urinary obstruction in boys is the posterior urethral valves. Posterior urethral valves is the most common cause of urinary obstruction in boys. Now, the most common indication for ileostomy is IB, inflammatory bowel disease, and for colostomy is colorectal carcinoma. This is very important. Now, overall, most common indication for an ostomy is inflammatory bowel disease, which is a more common indication than colorectal carcinoma. So this is colostomy. Okay, so this is colostomy. Now, femoral is the most common hernia to strangulate. The most common hernia to strangulate, this is a very important point. The most common hernia to strangulate is the femoral hernia. Now, the extra abdominal hernia are the more common. The most common hernias among all the extra abdominal hernias. Now, the most common biliary complication, lap cholecystectomy, and as the bile duct leak from the cystic duct stump. This is very important. Bile duct leak from cystic duct stump. Now, the most common biliary complications of liver transplantation. So this is obstruction. This is obstruction and stenosis at that. Anastomosis is the most common biliary complication after the liver transplant, and before was the most common biliary complication after lap chole is the bile duct leak from the cystic duct stump. Now, the most common cause of chronic hydronephrosis in renal transsolent, UV anastomosis stricture. UV anastomosis stricture is the most common cause of chronic hydronephrosis in renal transplant. Now, the most common cause of colonic obstruction in males is the malignancy. So, the most common cause of colonic obstruction in adults and the most common cause of colonic obstruction in the infants, this is meconium plug syndrome in the CF patients. Now, this is important to remember. In adults, it is malignancy. In infants, it is meconium plug syndrome. Now, the most common periphery artery aneurysm is the popliteal artery aneurysm. Now, the most common complication of popliteal artery aneurysm is the distal ischemia. So, the most common peripheral artery aneurysm is the popliteal artery aneurysm, and the most common complication is distal ischemia, thrombosis or embolism. The most common complication with IVC filters is the DVT. This is very important question. Now, the most common cause of biliary obstruction is the choledocholithiasis. Most common cause of biliary obstruction is the choledocholithiasis. Now, the most common involved segment of the colon with diverticulitis is the sigmoid colon. The most commonly involved segment of the colon with the diverticulitis is the sigmoid colon. Also, the most common cause of biliary obstruction is the choledocholithiasis. Now, the sphincter of Odai. The sphincter of Odai consists of 3 sphincters at 3 levels. So, first at the end of the bile duct, second at the end of the pancreatic duct, and third around the ampulla. So this is very, very important, the anatomy things. See, the sphincter of Odai has 3 sphincters at 3 levels. First at the end of the bile duct, second at the end of the pancreatic duct, and third around the ampulla. Now, accessory pancreatic tissue most commonly found in accessory pancreatic tissue most commonly found in the stomach and the Meckel's diverticulum. So this is also very important. Accessory pancreatic tissue. Now, accessory spleen most commonly found in the splenic hilum and vascular pedicle. So, splenic hilum is asked. The most common indication for ERCP. ERCP you have to do for choledocholithiasis. This is choledocholithiasis, and we have studied that what choledocholithiasis is being the most common cause of biliary obstruction. Okay, so this is very important. Correlate things and then study. Now, the most common complication following the ERCP. After ERCP, the most common complication is the acute pancreatitis. This is very important. Now, most common brachiogenic anomaly. This is the second brachial arch remnant. Most common second arch anomaly in children is the fistulas, then the sinuses, and then the cysts. So the most common are the fistulas. The most common second arch anomaly. Now, the most common second arch in adults, that was in children, the fistulas. Now, in adults, it is the cysts. Now, the most common cause of pseudomembranous colitis is the Clostridium difficile. The most common cause of pseudomembranous colitis is the Clostridium difficile. Now, the lung cancer in India, the most commonly with the squamous cell carcinoma is the most common. This is very important. The pyoderma gangrenosum is the most commonly associated with ulcerative colitis. This is very, very important. The pyoderma gangrenosum associated with ulcerative colitis. Now, the most common hernia in females is the indirect inguinal hernia. Indirect inguinal hernia. The most common cause of nipple discharge is the intraductal papilloma. Intraductal papilloma. The most frequent complication of a giant gastric ulcer is perforation. The most frequent complication is the giant gastric ulcer is the perforation, and it is an emergency. Now, the most common site of diverticulitis is the sigmoid colon. The most common site of diverticulosis is the sigmoid colon. The most common site of bleeding with diverticula is the ascending colon. Ascending colon, the most common site of bleeding diverticulum. Now, the most common site of rupture of abdominal aneurysm is below the origin of renal arteries. This is very important. Rupture of abdominal aneurysm is below the origin of renal arteries. Now, most common underwater blast injuries. So, bowel is more involved than the lungs. This is tricky but very much asked. Underwater blast injuries. Now, the blast injury organ affected. The middle ear cavity is much affected. Then come the lung, and then come the bowel. This is important. Remember, bowel was more injured in the underwater blast, and the blast injury organs, middle ear cavity is the most common affected. Now, the penetrating abdominal injuries most commonly involve the small intestines. Axillary abscess is drained safely by floor approach. Now, this is nowadays they can ask these approaches. So remember this: for floor approach, axillary abscess is drained by floor approach. The most common artery dissected during arteriography is external iliac artery. External iliac artery is most common artery dissected. Now, the colovesical fistula most commonly arises from the Crohn's disease. Colovesical, C for Crohn's and C for colovesical fistula. Now, the most common cause of pseudopancreatic cyst in children is the traumatic pancreatitis. Traumatic pancreatitis, the most common cause of pseudopancreatic cyst in children. The most common site of pseudopancreatic cyst is the body and the tail of the pancreas. Body and the tail of the pancreas, the most common site of pseudopancreatic cyst. Now, the most common type of intussusception. First is the ilioiliac, very important question. Ilioiliac, then ileocolic, ilioileal. Now, colocolic, multiple, and retrograde. These are the types of intussusception. So ileocolic is the most important. And the most common site of deep vein thrombosis is the calf veins. Everyone knows that. Most common cause of pulmonary embolism is the thrombosis of the leg veins. Most common source of emboli, iliofemoral veins. Emboli is the iliofemoral veins, the most common source. The most common benign tumor of stomach, leiomyomas. Now the most common presentation of leiomyomas, asymptomatic. Leiomyomas are asymptomatic. The most common symptom of leiomyoma is the GI bleeding. The most common site of regional enteritis, distal ileum and colon. So the most common complication after ERCP is acute pancreatitis, what I've told you. The most common site of intestinal obstruction, gallstone ileus, is the ileum, ileocecal valve. This is important. Obstruction in gallstone ileus is the ileum, ileocecal valve. The most common type of choledochal cyst is the fusiform dilation of the extrahepatic duct of type 1C. Type 1C, fusiform dilatation of the extrahepatic duct, the most common type of choledochal cyst. Now the most common type of congenital internal hernia is the left paraduodenal hernia, the most common type. The most common type of gallbladder inflammation is the chronic cholecystitis. Chronic cholecystitis is the gallbladder inflammation, most common type. Most common type of abdominal wall hernias, the inguinal hernias or the abdominal wall hernias. Now the most common type of internal hernia is the post-op transmesenteric hernias. Post-op transmesenteric hernias. Now the most common type of non-iatrogenic internal hernia is the left paraduodenal hernia. Non-iatrogenic internal hernia is the left paraduodenal hernia. And the most common type of liver abscess, the pyogenic liver abscess. This one is easier. So these are the very important most common in surgeries. So remember these, try to remember this, and these can be the direct question in NEET PG 2021. So all the best and revise well. I will be coming up with more of the most commons in other subjects also, so stay tuned.